Hi, I'm Dr. Adelia Krebsier, a naturopathic doctor from Tiger Medical Institute. So I'm here today to answer the question, how to check if I have Alzheimer's disease. So I'm going to go over a few options here in terms of practitioners as well as assessments to properly screen for Alzheimer's disease. So first off, we always recommend that people go see their primary care practitioners just to make sure that everything is in working order at a basic level, and then also for referrals, which we'll often need. So in terms of Alzheimer's, it is complex in terms of its diagnosis, so people often don't know where to start. So I'm just kind of going to simplify it for you with a couple of options. So one thing is you can get a cognitive assessment from a neuropsychologist, and you can get a referral to one of them. They're a type of psychologist that will do screening tests. So things like the MOCA, the Montreal Cognitive Assessment, or a mini mental state examination. They have a number of tests to just assess your overall cognition without doing the medical imaging and stuff like that. So if you do have any signs of cognitive decline, if you have new onset memory loss or disorientation or trouble organizing yourself personally or at work, especially symptoms like that are new, you may be referred to a neurologist, or you can request to be referred to a neurologist. So they can do things like brain scanning, like MRIs, and they can also do cerebrospinal fluid testing or genetic testing. With the cognitive assessments and some of the physical exams, then you can find out if you meet the criteria for a diagnosis, or just if you have any kind of more objective cognitive decline. The other option is to see a naturopathic doctor or a medical doctor that's trained with the Apollo Health Institute. So the conventional care is not very effective for Alzheimer's disease. And it is quite tragic in some ways because 21st century medicine, has been very helpful in curing and treating lots of different diseases, but Alzheimer's has not been up to that standard at all. And the rates have also really increased. So with that being said, recently there's been a lot of research in the past couple decades, a growing body of research into the complex drivers of Alzheimer's disease. And we're actually finding that we can prevent it, and that it can often also be treated as long as it's not in its late stages. So Dr. Dale Bredesen from the Apollo Health Institute is training thousands of functional medical doctors, naturopathic doctors, and certified health coaches. So those practitioners can do assessments, and they can also make lifestyle recommendations. So often it'll be things like diet, movement, sleep hygiene, lowering inflammation, and they can find out exactly what the root cause is for an individual, and then they can tailor their treatment based on that root cause. So they'll have a whole range of tests. A cognoscopy is often the first place to start with the Apollo Health Institute. So you can do a free cognitive assessment. And I've included the link in the article entitled How to Check If You Have Alzheimer's Disease. So you can just do that free 15-minute assessment. And if you do want to work with a practitioner, they would run you through some basic blood tests as well as brain imaging and volumetrics if you have any of the actual signs. So that's kind of a quick summary. So between primary care, neuropsychologists, neurologists, as well as Apollo trained practitioners, you should have a really good sense of where your cognitive health is at, if you're experiencing any cognitive decline, and if you have Alzheimer's disease.